So what we did in the study, so for PET-CT, it's important for staging the disease, it's important to assessing treatment. Actually, our institution has shown that PET-CT negativity at 100 days post-transplant is associated with better outcomes. What we especially want to do in our study was to check if PET-CT at 6 months, which is a relatively early period compared to the start of treatment, could actually improve the definitions of the IMWG criteria of hematologic response, so VGPR, CR, and PR, and worse responses. So what we did is we checked patients that were at our institution, 195 patients that had a PET-CT both at diagnosis and at 6 months post-treatment. And we found also the hematologic response these patients had. And what we found is that not only PET-CT by itself improves both progression-free survival, time to next treatment, and overall survival, but when subgrouping patients based on the hematologic responses, we found that it consistently improved the responses. So for VGPR or better, patients who at 6 months achieved VGPR or better, we found that a PET-CT negativity at that point improves both PFS and overall survival. And for patients with PR or worse, if they actually managed to have a negative PET-CT at that point, they also had improved progression-free survival and overall survival. These findings were also shown in both in univariate and multivariable analysis that PET-CT negativity at 6 months improves progression-free survival, time to the next treatment, and overall survival. In terms of what we can do in the future, although we used PET-CT negativity, this is relatively a crude estimate. We were based on the FDG metabolic activity, but incorporating the SUV values and more standardized scores will be the next step to really see how PET-CT could better help risk stratify patients both at diagnosis and at later stages, at 6 months or even later than that.